people say, I have a right to healthcare. But
That's wrong.
That's
you
wrong.
don't have a right to healthcare. Healthcare is a commodity. You have to pay for it. If you don't pay, someone has to pay for it.
Right. which actually what you're getting at here is something very profound, which is this. There's no such thing as a right that involves reaching into somebody else's back pocket, right?
Exactly.
So if you have a free speech right, it doesn't cost me anything, right? You're not making me pay to enable you to speak, and therefore you have a right to do it. But you're saying, on the other hand, if you want to spend money and go to a doctor and receive services, that can't be in the same sense a right. It's got to be something where we have to decide as a society, like, how do we allocate resources? Is that what you're saying?
Yes. And that's the success of the past 56 years of health policy, to make people believe healthcare is a right. I'll be entitled to healthcare, which is wrong.
Because let's show why it's wrong. Because let me put it this way. Let's say I now say I have a right to food. Nobody would disagree. They'd be like, of course you have a right to food. So then I go, all right, well, why don't I just go to the grocery store and fill up my cart and then just walk right by the cashier and don't pay because I have a right to food, right? Now, I think as an economist, as an accountant, you know completely that if you allowed that to happen, first of all, it's not that nobody's paying. It's just that you have a cashier, you have a consumer, and the guy who's really paying is not present in the transaction, right? Because that's a taxpayer who's at work in a machine factory or as a plumber. That's the guy who's really paying, right? And so what's really happening here is that the consumer is ripping off the system. The grocery store goes, great, because you can just walk out with whatever you want. We're going to be billing that guy. And I say all this because, to me, that's our healthcare system.
You touched the key point, like the third-party payment system.
Right.
The patients, not consumers. The third party are either insurance companies or the government. So for the past 6 years, the government-centered policies have been detaching patients from their either earned or subsidized healthcare dollars. That creates a loss of price sensitivity. And I would say that's a root cause of the mess we're in. That's why President Trump said, let's fund the patients, which I think is such a profound and insightful idea.
We all know that when we go to a doctor, I mean, the system is all so odd, right? Because you go to a doctor, let's say, and you say, I don't know, I have a pain in my right side. And the doctor will say, all right, well, let's run a series of tests. Or there's a hospital will say, let's run a series of tests. Now, the patient will never think of saying, what tests are you going to run? And can you explain to me why each of these tests are necessary? And the reason that the patient never dreams of saying that is typically the patient is not paying.
Exactly.
Right? But in any other thing, if I go in, let's just say, to Home Depot, and I say, I want to fix my kitchen, and they go, okay, we'll give you 45 items that you should buy right now, you'd be like, wait a minute, slow down. Let's go down the list to see what I need and what I don't need. So this normal system of kind of accountability, I think what you're saying, disappears in the healthcare process. Yes. How do you put it back?
Yeah. So providers right now focus on compliance. How do I get the money from the insurance companies or from the government, instead of persuading the patients, look, my service is valuable, so pay me, right? So completely upside down. So in order to change that, we must let patients control their healthcare dollars.
Now, one of the objections to that is going to be, you're going to have some people say, I'm just kind of imagining an objection, which would be, okay, if you're fixing your kitchen or picking up food, you, the patient, are knowledgeable enough to know what to eat, and you may be knowledgeable enough to know how to fix your kitchen, but you are not knowledgeable when it comes to healthcare. The doctor knows better, the hospital knows better, so we cannot let you be the decision maker because you don't actually know.
I disagree. First of all, let's look at the cash pay markets. If I go to a cash pay only surgical center, before I go there, go to the website, they have very clear description of the price and the service. So they even put the pictures, like, are you doing shoulder? What do you need? So they really tried hard to convey what they're doing, how they bundle the price.
You mean like these urgent care centers, right?
Where surgical centers, like Oklahoma surgical centers. So once we have a free market, patients control their money, the providers will compete to communicate to patients why the patient should get that service. That is the origin of all the transformative change.
When I first came to America around 1980, I had $500 in my pocket. That's it. Now, if I'd been really frugal and not spent a penny of that money, what do you think it would be worth now? What could it actually buy now compared to what it could buy in 1980? Well, the answer, less than $130. Now, why is that? Because the US government, through the Fed, is constantly printing money and devaluing your money. When the government prints money, there's more money chasing the same amount of goods and services. So guess what? Money goes down in value. Money buys less. The Fed has been at it since 1913. That's why $1 today can buy just what a few cents could buy in 1913. And the government continues to print oceans of money. It really never stops. Now, an ounce of gold reached a high of $850 in 1980. It's worth now around $3,900 an ounce. So historically, over time, we see gold has gone up and up in value. Dollars have gone down and down. And what about in the last 12 months? Gold is up over 40%. I believe now is the time to find out how you can diversify your savings with gold and silver. And this is why I've partnered with Goldco. They offer the best customer service for precious metals ownership. They are also the only gold dealer that offers a first-time gold buyer rebate of up to 10% in bonus silver on qualified purchases. There's no better offer out there, so take advantage. To learn more about how to safeguard your savings from the dollar's decline, go to dineshgold.com. Very simple, easy to remember, dineshgold.com.